Dearest colleagues, welcome to the Vision Straight Masterclass Series, Season 2. I'm Obi Malope, an optometrist based in South Africa, the motherland. And today, I'm with a fellow colleague from the motherland, of course, none other than Dr. Araba Otoo. How are you today, Doc?
I'm doing great. How are you?
I'm very well, thank you.
Uh-huh.
Last year, I did a masterclass series on behalf of Vision Straight, and one of the incredible guests that we had on the platform was Dr. Adam Ramsey.
Okay.
And the conditions that he set for us to be able to do the masterclass series was only one. He says that, Obi, if I come onto your platform, it will be on the basis that very soon you will get Dr. Araba on the platform as well. Because if there's a young dynamic leader who's going to change the eye care landscape, especially in public health, optometry, is Dr. Otoo. And I connected with you and I've been following you on different social media platforms. And my, oh my, what an incredible leader you are. And so it makes sense that we will have a masterclass series with you because you are one person that is breaking barriers. But enough about that. The eye care industry would love to know who Dr. Araba is.
Yeah. Well, thank you for the opportunity to be on here. And thank you, Dr. Ramsey, for the recommendation. I am honored to be on here to talk about, anything about public health and optometry and how we can possibly integrate these two fields to improve visual health outcomes among the patients that we take care of. Well,
Wow.
as to who I am, I was born in Ghana. I moved to the United States back in 2007. And then I went to college here. I did a master's degree in public health here in the United States, in Chicagoland area. And then I went to Ohio State for optometry school. And then after optometry school, I went on to do residency in Fort Wayne, Indiana. Finished residency about 2 months ago. Was able to go back home to Ghana and just see some friends and family. Recently came back and I'm just about to start working in the next few days. So
Wow. How does that feel? Knowing that you've gone through this intense level of training for a very long time.
Right.
How does it feel now
Well,
that you're going to start making money?
it is great. It's like it's exciting and at the same time a little bit of nervousness there, but it is great to know that all the hard work over the years is about to pay off, and I am excited to actually, be the eye doctor and make decisions for my patients and help, advance eye health in that way. So no longer a student, full-blown adult at this point, responsible for people. And it is exciting. Again, there's a little bit of nervousness, but that will dwindle as time goes on. So I am looking forward to this a lot.
We are super excited to see you being in the industry and working as an optometrist because your passion is clear from the work that you have always been doing through being a student. Where did that passion come from, or what inspired or ignited that passion that you have when it comes to public health?
So I want to say that it goes back to growing in Ghana. I feel like growing up, I was not really aware of what public health is, but now when I look back, I can see very much how public health is practiced almost unconsciously back home, with eliminating malaria, if I should say. Every season we have Apollo, which is like hemorrhagic conjunctivitis going on. I think malaria is a big one, right? So you would always find posters on walls and telling people to sleep in mosquito nets and, all these campaigns going on. So again, when I was growing up there, I was not that aware, but after going through all this training where public health is concerned, I can very much see how public health is very much integrated in my culture back home, just because, healthcare is not great. So if healthcare is not great, there's a lot of public health interventions that need to be done to make sure that people are getting the best healthcare that they can get in that society. So I want to say that's where I came from. But as to my education and kind of being aware and formulating all these ideas, definitely from the United States. So I have benefited from, being able to grow up in Ghana and being in America and learning different things from different places and bringing them together. So hopefully that answers your question.
Wow. That is very powerful. But now the dynamics in terms of public health
Mm-hmm.
challenges or opportunities in Africa in relation to being in the United States, I could imagine they are worlds apart.
Yes.
And so, with how you went in and described the passion that you had for public health and what ignited and inspired it, but based on where you are at right now and you are about to start working, is the plan then to move to Africa soon, or how is that all going to work out? And what is the difference in public health optometry in America versus what you then have been exposed to back home in Africa?
There's so many layers to your question. And
Yes,
in
yes,
fact, when I went back to Ghana, that was actually a hot topic. Like, okay, so now that you're done, are you going to come back home and work here? And I think that's a very noble thing to think about. That is something that I desire to do. But I am one person and I cannot really split myself into two and be there and be here. When I was going through my training, especially my public health training, I did a lot of global health work. I worked with an organization called Unite for Sight. They work in Ghana, India, and Honduras. So I was able to go to Ghana for like 2 months and volunteer there. And that is where I want to say that, now I came in as a foreigner, right? I was able to navigate the country. I went to so many places that I had never visited when I lived there.
yes.
So that trip was very good and very nice. And I was able to visit so many aspects of the country and get a better sense of what healthcare is out there, as opposed to when I lived there. Now, when it comes to eye care, and I'm not going to make it about optometry, I'm just going to make it eye care in general.
Oh.
As in the States, I am in a developed world right here. But the extent of problems we have in eye care exist in the United States. We have problems here. People are, going blind from glaucoma. We have diabetic retinopathy as an issue. We have lack of awareness, simple refractive error. So if in a developed world, we have all these problems, as you may know, it's even worse back home. Like if
Correct.
it exists in the United States, it exists
Correct.
in Ghana, it exists in South Africa, and it exists in
Correct.
many other places. Human beings across the globe have eyes. So wherever you find yourself, vision and eye health to me is imperative. It's valuable to you because you need those eyes to be able to do your daily activities. So if the problem exists in America in the developed world, it very much exists in the underdeveloped world.
Correct.
And you'd be very surprised how the problems that exist in Ghana also exist in America. It's just a different, the barriers back there may be more intense or more a laundry list compared to the barriers in the United States. But I think the problems in eye care, delivery, barriers, the disease that we treat exist wherever you find yourself. It's just a different level as to where you are.
Wow.
So I don't
Wow.
think that gives you the difference would be that the magnitude is different, but the problem still exists wherever you find yourself.
Correct.
Going back to, am I going to go back home and work there? Again, that would be great. That would be an ideal world. But here I find myself in the United States and having schooled here, and I owe the US government a lot of money. So how am I going to live there and get paid enough to pay my debt to the US government? Okay.
Yeah.
So this is me being realistic about it. Now, as I went home, again, this question came up a lot. My scope of practice is very different in America versus my scope of practice in Ghana. Okay.
Correct.
My scope of practice here is wide compared to that of Ghana. So unfortunately, uprooting myself and going back there, for lack of better words, may render me, this is a harsh word, but may render me useless on something. No, on some things. Do you get what I'm trying to say? Not everything.
Yeah.
I think my best contribution that I can give back there at this point will be from the angle of education, right? Where I can go every so often and go to one of the optometry schools there and impact what I have learned from here, whether it's a lecture or actually clinical practice. I think that's what would be very beneficial at this point, because if somebody has knowledge, you cannot take that away from them. Okay. But again, just as we have rules in the United States and what I can do here, there are rules in Ghana as to what I can't do here, there. Okay. And if America allows me to do something, but Ghana does not necessarily allow me to do something, then again, going back there shrinks my scope of practice, which I would not appreciate, right? I want to be able to do as more that I can do, but that environment needs to be accommodative of me. So, in terms of like contributing to that society, and not necessarily just Ghana, but like the global world, right? This is part of why I the nonprofit that I created comes into play. So the nonprofit is supposed to kind of the beginnings of me trying to integrate public health and optometry, and in some essence, global health. And global health in the sense that I cannot be physically in all these places at the same time. So if I create something, an educational tool that could be disseminated over social media, over internet, so that people can have access to it, then yes, it's not big, but it's something, So that is how I am beginning to integrate public health and to some extent global health in what I am doing, without physically having to be in these different locations. I think it will be great if someone will hire me and pay me enough to pay US bills. I would stay in Ghana. It's a beautiful place to be. So,
wow, I like how you answered that question in such a comprehensive manner. And one thing that I must say, having or being based here on the continent of Africa, is that Optometric Association of Ghana, they've been sprinkled with something special. They just, those young ladies and young gentlemen in eye care at the current moment, they seem to have a passion, like no other students on the continent of Africa when it comes to public health.
Right.
There's just something about what I've noticed and observed of them over the last 3 years. They've got a passion for making a difference.
Right.
So I think in the near future, we will hopefully get to a situation where we can connect with you, with what you're doing, with their passion and what they want to be doing.
Right.
And I think when minds come together, or different minds coming together that are passionate about making a difference, a long-lasting impact in communities, in society, not in just one community, but across the globe, I think a lot of amazing initiatives will be birthed from that process. So for me, I'm super excited hearing like how deeply rooted your passion is, and that you're not going to allow any form of barriers prevent you from getting the work done. It might take long, but you are committed to that process. So my next question then becomes, with what you know and what you have been exposed to, what are some of those barriers that are existing in healthcare or public healthcare, if I can put it that way?
So with your question, initially I was like, oh, is the barriers like what barriers I see in Ghana as opposed to the United States, or just like barriers in practicing
in general?
Okay. So
you can even break it down. There could be structural barriers, there could be financial barriers, there could be public awareness barriers, there could be cultural barriers. So don't limit how you answer the question, because I think that perhaps the barriers might be different in different countries, but there will definitely be barriers. So I think you've got free flow in terms of how best you want to answer that question.
Okay. So when I think of barriers, most of the time what comes to mind is what barriers are patients facing or hindering their access to us as clinicians, okay? And the big, there are so many barriers, and some of them can be addressed by us, as in like the how do you call it, the practitioner, right? But some of them are just state level problems, or something that the government has to intervene to do something about. But I think from our providers and patients, a huge barrier for me is the lack of awareness or the knowledge, right? Because we know that a lot of eye conditions are asymptomatic, okay? The fact that you do not feel anything, however, does not mean that your eyes are okay and perfectly fine. We know, for example, glaucoma being the silent thief of sight, right? You could have glaucoma developing, and if you do not ever go check those eyes for them to look at your eye pressure, your optic nerve, or check your visual fields, you think the whole world is fine and dandy, you know? So I think that a huge barrier to patients or people achieving their best health outcomes as they grow older is the fact that they do not know, they lack awareness, and put very little emphasis on their eye health, right? Because you have people who, when you ask them, well, when was the last time you got an eye exam? It's okay, never. Or I don't feel any pain. I feel just fine. What's the point of going to an eye doctor? Why do I want to spend money that I don't have, right? And in our society, Ghana, South Africa, sometimes it's different. Sometimes people have to allocate their resources, and I'm talking about financial resources, for them
Yes.
to make decisions. Okay, I need to buy food for my family and my eyes are fine. So yes, I'm gonna buy food for my family. I'm not gonna go get an eye doctor. Okay. So that's different. Unfortunately, sometimes you have to make those tough decisions. Where do I allocate my resources? The problem to me is where people do not have any barriers. For example, they do not have any financial barriers. They can perfectly feed themselves. They have health insurance, but then they still do not go to the eye doctor. That is where it's problematic for me, because that person does not know that, something could be wrong with your eye, and go to get it checked. So those are the things that I purposefully want to address, especially if people don't have any barriers and yet still they don't go to the eye doctor. So at that point, it's probably like a lack of awareness issue. They do not know, because when people know, I would hope that they will do better, and I would hope that they will make informed decisions when they come to their eye health, especially because when you ask them, like, how important is your vision to you, they rate it very high. Of all the senses, which one would you afford, can you afford to lose? It's never the eye. So people put a lot of value to eyesight, but they never seem to do anything to keep it in the greatest shape or form. So I think education is a huge barrier when it comes to patients reaching out for eye care services or doing the best thing when it comes to their eyes. Obviously, finances is one. It looks like you have to say something.
Yes, I wanted to add on to that point that before you move on to the next point, was on the awareness part. I don't know how it is in America, right? But what I've picked up in South Africa, for example, is that in public health, people don't associate eye problems with death.
Okay.
But if they have a kidney problem, if they have a liver problem, if they have a heart problem, if they have any other organ problem, it's as if the awareness around that is that they could die.
Right.
Whereas with the eye, like you're saying, no one would want to lose their sense of sight. But yet it's never associated with, I could die.
Right.
And so the priority level when it comes to how we take care of our eyes in the public sector is somehow pushed down to the bottom as compared to the other senses or other problems that exist in healthcare. So I've always found that very interesting, how if you had to ask a person, what sense would you never want to lose? It will be the vision, right?
Right.
But when it comes to, like what you said, how we manage it and our priority level, I've always found that very interesting, that because it's never associated with death, like diabetes, hypertension, and all these other things in the public sector that people are experiencing. It's sort of like a nurse stands a better chance convincing a patient about the importance of the diabetic medication than an optometrist does convincing a patient of regular eye exams.
Right.
And I find that very, very concerning, that how can that disparity be so broadened, and it's like that across the globe. So I just wanted to make that point in terms of, are you experiencing the same thing as well?
So to piggyback what you said, I don't think it's just South Africa. I think it's a common way that people think, like, this is not a life or death, so why should I focus on it? I mean, granted, if you come to me and you're having a heart attack, I'm not going to say, sit here and let me check your eyes. No, you're going to emergency, right? So even for me, there is a priority list. If you're dying in my chair, the eye can be addressed later, okay? But people need to recognize that vision problems do not occur in isolation, right? We talked about diabetes. When your diabetes is bad, guess what? Your eyes are going to be bad. And the
100%.
treatment is to address the diabetes, okay? So we are not opposed to prioritizing other conditions. If you have a systemic condition, sarcoidosis, that's affecting your eye, I need you to address that sarcoid, because that's what's causing your eye problems. But once again, there are times that people will go to an eye doctor, and it is through the eye doctor that we find a condition that could be causing death, or
Correct.
a condition, and again, we know eye problems are not okay in isolation. So let's say that you have, I don't know, diabetes, because that's the most common thing that comes to mind. And then your eyes are being affected. Now you can't see, you are an elderly, you trip and fall. Now you break your arm. Now you get what I mean? Everything is going downhill. So when we address eye problems in conjunction with all these other things that are affecting the eyes, then you can increase or improve the person's overall quality of life. Because again, the diabetes affected the eye. Now you're going blind, you fell, you broke your arm, you broke your hip. Now the whole world is falling apart. So yes, I completely understand prioritizing other conditions over your eyes, but we can do it in tandem so that we can improve the quality, the overall quality of a person's life.
Wow. No, very interesting. Very interesting. You wanted to go into the financial type of barriers that might exist before I interrupted you earlier.
Well, so finances, I feel like it's simply like, can someone afford it, right? So from the patient's perspective. But when I also think about like industry, we create all these medications and we create all these equipments and we use it for testing, and patients have to pay. And sometimes they are expensive,
Correct.
And sometimes understandably so, because there are resources that went into the production of this medication and this tool, and you need to pay for that, But that could obviously be a barrier if you have people who cannot afford said medication or the equipment to be able to use to diagnose them with a condition. And it's a tough thing to answer, and it's a tough thing to deal with. Like, as an individual, I cannot go and be like, oh, make sure when you do OCTs for your patient, and I'm just coming up with something that comes to mind for your patients, make sure it's not as expensive. Make sure that scanning the retina is covered and it's not an extra cost. I can't go and do that, right? Sometimes patients will need help where that is concerned, or the patients just have to find the finances. It's a very tough thing to deal with. And I feel like, again, in the public health world, we are very good at pointing out problems and not so good at addressing the problems, in part because, again, the stakeholders in public health are many. You have the governmental level, you have the state level, you have local level. And so it's like, what can I address, right? As a person, I can participate to some extent in legislation, right? Getting my opinions out there. But as an individual, I cannot really force the state to buy into what I'm saying and make sure that everybody in the community gets insurance, and that insurance will cover all their healthcare needs, right? But so, because sometimes it gets overwhelming with all these barriers as an individual, that's why we, or I, have taken the arm of education as something that I can do by myself, right? Because if I have a patient in my chair, maybe I cannot pay for them. Maybe I cannot move them to an apartment that's like 5 minutes away from the clinic so that they don't have the issue of transportation coming to me. But what I can do is to make sure that I give them knowledge, right? So that with that knowledge, if you have 5 barriers and knowledge is one of the barriers, at least I have eliminated that knowledge barrier, so there is only so much that we can do as individuals. Some of these changes need to come from the top, but the things that are within our realm that we can address, we should be addressing. That includes being very empathetic towards patients, listening to patients, because sometimes we diagnose and we come up with, you need to do this, you need to do this, you need to do this, without realizing what exactly is preventing the patient from being compliant with you. Maybe it's because they don't have a support system at home. Maybe it's because, so many things come to mind. Let's think about diabetes, right? Very often we have diabetic patients in our chair, and sometimes we are quick to say, oh, go and see your primary care doctor, take your metformin, go and exercise, go and eat
Yes.
healthy. We say all these things. But what does eating healthy mean? You never communicated that to the patients.
True.
What does exercising mean? We can all take walks, and walks are great. But what kind of exercises should that person be taking it? If the person is an amputee, do you really expect that person to be taking walks? No.
Wow.
So we don't just go and say, go to your primary care doctor. What if the primary care doctor also told them, go to your eye doctor? Then nobody communicated, right? So we should be, in my view, be doing more than just go and eat healthy. And what we can do there is, if we, in your community, wherever you practice, you become very well versed with that community and the resources available. So for example, if you know, like, oh, there's a good grocery store here that sells good green vegetables and fruits and they're affordable, you actually give that solid resource to the patients. Like, go this here. They have kale on sale this weekend. You can buy the kale and do this, And then if you have, like, it is complicated, I understand, but again, all I'm saying is that we can do more than we are doing now, just by becoming well versed with the community in which we practice, and not just telling patients that go and eat healthy, right? Because if they live in a food desert, which is usually communities that might not have grocery stores around them, they have to drive 15 or 20 minutes away to go to a grocery store. What if that person does not have a car? Now they cannot go to the grocery store, right? Now, so there are so many things. So if the person lives in a food desert, already that's a problem that you as an individual cannot solve. You cannot go and build a grocery store in the backyard of the person. But talking about backyard, you can encourage gardening. Okay, that's another way that we try to address the issue of, how do you call it, food deserts. Encouraging people to garden, grow your vegetables in your backyard so that you can harvest it and eat it. But again, if you have somebody who is sick, how do you expect that person to go garden? Okay, if this person lives in a food desert and all they have around them is like gas stations very often do not carry the foods that you will encourage diabetics to eat. So if what they have access to is, processed food and donuts in packages and Pringles and all that, again, telling them to eat healthy just went down the drain. Okay, so there are things that we cannot address as individuals, and again, it does get overwhelming thinking about it, but we can very much come up with ways and different things that we can encourage patients to do. And while you are in this community and recognizing the different things that causes barriers to patients, you can again let your opinion get known to the states, or you can even get involved in the state public health organizations. And because they tend to do all these things. When I was in the School of Public Health getting my public health education, this is all we talked about: diabetes and exercising and creating green space for people to exercise. Because again, if you live in a community that's not safe, i.e., let's say gun violence or whatever, you are not going to feel safe to go out to go exercise, right? Sure. So then we have to address that root problem. Or if you're in a place that does not have let's say footpaths for people to ride their bikes or walk, then that's also a problem, right?
Absolutely.
It's a problem that you as an individual cannot solve, but it's a problem that we need to let the community and the stakeholders in that community know, so that in planning the structure of the community, they take these things into considerations. In Chicagoland area, as well as so many different places, we always have like bikes around. Yes, it's not cheap. You got to pay for it.
Yes.
But there is still that resource that someone can get on a bike, right? It's usually for transportation, but there could simply be a recreational thing where people can get on bikes and ride around, and that's a form of exercise, right? Anyway, hopefully that answered your question.
Absolutely.
I did write culture here, and I can think of, like, in the United States, once again, people not knowing, and because of that, they do not go get eye exam. I think there is a need for a lot of education and a lot of awareness. Another aspect of culture that I can think of is like immigrants, right? When we come in, some people are very and it's not just immigrants. I'm talking about like skepticism or the lack of trust in the healthcare system. Or some people are also like very stuck in their old ways. So let's just think about like an African person who likes a lot of carbs in their food, like all the fufu and the rice that we eat. We know that when you have diabetes or so many other things, you need to watch your diet, and these things are not encouraged, right? But how do you go tell your African mom who ate fufu 5 days of the week to stop eating fufu just because it's not healthy and it's not going to help them? So
yeah, that doesn't make any sense. She's not even going to bother listening to you.
right. So, I think, but these things can be changed, right? As long as you educate the person and you help them to recognize that, I know your vision is important. And to be able to preserve your vision, I need you to eat healthy. I need you to take the medication that the doctor gives you. I need you to exercise. These things can be changed. And once the person does it for a period of time, it becomes a habit. Okay. So it's not that you can't change them. People just need to be educated. People need to know more. People need to be aware. And hopefully, once you have done your part educating them, then the rest is on them. Because I did my part educating you. I need you to hop on the wagon so that we can work together and get to a good health outcome.
One thing you have to explain. There are people from all over the world that are going to be watching this.
Okay.
And there's someone probably sitting in Portugal or Poland, and they're going to be asking themselves, what is fufu? What is Araba? So
yeah,
you have to answer that before we continue with the conversation.
Sure. So fufu is a starchy ball. Fufu is a starchy ball of either plantains or yams or cassava. And it's usually dished as an island. So you have the ball of starch and you have like soup around it and a lot of protein, like your meat, your snail, your pork, whatever meat you can think of. But okay, let me get serious now. Okay, so I don't know. A lot of people don't know what cassava is, but cassava, like in the United States, it's like yuca, which is also very familiar with the Spanish population. So you have yuca and you have yams. What I call yam is very different from what is called yam in the United States. But yam in Ghana is, again, a root tuber, which is full of carbs. And then you have plantains. I think a lot of people know plantains. So you can make fufu from plantains too. So usually these foods, starchy food, root tubers are pounded and they make it into a ball, like I said, a ball of starchy food. And then it's bland by itself. It doesn't have a taste. And then you eat it with soup. So they have different kinds of soup: peanut butter soup, palm nut soup, light soup, goat soup, you name it. And so that's the dish. So hopefully that's a good explanation. And if that's
a perfect explanation. Someone is going to go Google this.
Yes.
And they're going to be like, I have to make this. I have to go and find out how to make it because it sounds absolutely incredible. And then they're going to come back to us and tell us exactly how it tasted. But listen, I don't know in America, but sometimes in other parts of the world, people get into public health initially because they're very passionate about it. Then when they discover the huge disparity in pay between what people earn in the public sector versus what they earn in the private sector, that passion somehow sort of like slowly dies off over time. What can be done? Or have you ever experienced that in your experience with regards that disparity?
I immediately think, in the word public health, yes, we have the word public in there. But it does not necessarily mean working in the public sector. You know what I'm trying to say? Because I love that. I can be in public health and I learned epidemiology and biostatistics.
I love that. Right?
And then I would be working for, let's say, the CDC or the NIH or, all these organizations, nonprofit organizations. You know what I'm trying to say?
Yes.
So having gone into public health does not necessarily mean that I'm working for the public sector. I'm working in an entity that wants to maximize health for the general public. Population health.
You see, what you've just said that is absolutely important for people to understand. I love that. Please continue. Yes.
Okay. So I could do, in my public health, I did epidemiology and biostatistics, which involves, you have an outbreak and me assessing the root cause of it, or biostatistics, the incidence rates, the prevalence rate, the mortality rate, on and on and on. So these things become very imperative. When you think about COVID, these numbers were all imperative. So public health is broad. You can do public health and yes, go into the public sector, but I can do public health and go into the private sector as well. So I think that's something that we need to tease apart over there. The world of public health is focused with more prevention than treatment. Okay. So you have the public health practitioner, let's call it, and then you have the clinical, we are all trying to improve the health of somebody, but we do it from different angles. The doctor, or the person who is just like a doctor, clinician, is focused on that individual most of the time, versus the public health person who is more concerned with population health. So what are we going to do, vaccinations and on, to make sure that the population is healthy? And you are trying to promote prevention as opposed to cure, right? So imagine if we have like 1,000 people, and then you are successfully able to prevent 500 people from getting sick. Now, only 500 of those people go to the clinician. But if there's no prevention, then you have all 1,000 people going to the clinician.
Yes.
Now you're causing stress on the clinician. You know what I mean?
Yes.
So prevention is imperative. And so that's why we have like primary interventions to prevent stuff. You have secondary and you have tertiary. Okay. Once we already have the disease, then you are addressing a tertiary prevention. But we always want to do primary prevention to prevent the disease from even occurring. So when we have, accidents happening, right? Now, when somebody gets into an accident and they're injured, the clinician is concerned with keeping that person alive. From a public health perspective, I am looking at, was the road safe for the person to drive?
Love that.
Was the car safe for the person to drive? So I'm looking at what are the things that led to the accident, and those are the things that I'm trying to address. Versus the clinician who is addressing, oh, you hit your head, or you have an orbital fracture, let's address that. So does that make sense? So this is why, these two fields should not necessarily be operating differently. They should be helping each other.
Correct.
Once you have that primary prevention and secondary intervention all getting in place, then you are decreasing the amount of resources we are using downstream. Okay.
Yeah, love that. Here's the thing.
I think I diverted from your question, but
no, you actually answered it perfectly, because then it leads to the next part of the question. Right in the beginning of our conversation, at the core of what you were saying was education and awareness.
Right.
Now, first part of the question is, institutions or organizations or individuals who are trying to raise awareness, such as yourselves, do you have enough support from industry, from the corporates? Because when I look at specific competency areas in eye care, whether it be contact lenses, whether it be a focus on pediatric optometry or myopia control, I would use optometry as a reference point for, in our conversation. They seem to garner support far easier from industry as compared to other just as important aspects of vision or eye health or healthcare. That's the first part. Second part, when it comes to methods of communication or the platforms with which they communicate or educate or raise awareness on that particular subject matter, it's as if sometimes it's far more efficient, or the perception is that it's more efficient with these small competency areas in eye care as compared to an organization that focuses purely on public health awareness. What's your take on that? Because I'll give you a perfect example of what happened this past weekend.
Okay.
We had a contact lens conference taking place in South Africa right now. The awareness, the advertising, the marketing of it, the support that it garnered from industry was more than what you would find specific organizations that have a focus or a passion on public health, they don't gather as much support in a shorter space of time as compared to a contact lens conference that just took place this past weekend. And I see it happen in other parts of the world as well. So what's your thoughts around that?
Okay, so I am still not trying to navigate that space, right, where industry is concerned, because here I am trying to do something that's nonprofit, and I definitely needed resources. And I see a lot of value in it, but obviously you have to sell it to an industry for them to see the value in what you were doing, for them to
Yes.
buy it in, right? Now, let's say myopia management or dry eye, right? Those are I think those are easy to get support, because if you have an industry that is concerned with dry eye, you already have that common denominator, okay? So in essence, they have an agenda, and your work propels their agenda forward. So of course they will support you.
I see.
But that is great, and that is just a business tactic, and that is great. Completely understand. But it's a little bit myopic in my view, or very short-sighted, when that's all you are doing. Because, for example, let's think about dry eyes, okay? Now, and I'm going to go in all directions. Hopefully that makes sense, okay?
No, that's fine.
Now, public health, we are concerned with population. The people who make the population are you and I, the individuals that we see, okay? You are trying to sell dry eye stuff to people. Guess what? Those people from the public, okay? So, again, it should be the same agenda, but somehow you have to explain why they should buy in. Now, if you're selling dry eye stuff from a public health perspective, I'm talking about education. I still need to educate people about dry eyes.
Wow.
And the dry eye fits into eye care, because I am not concentrating on dry eyes or glaucoma, diabetic retinopathy, or whatever. I'm looking at everything pertaining to eyes. So the dry eye still fits in my world.
Yes.
But my world is, I want to educate people about the importance of dry eyes and how it could actually impact their vision.
Yes.
Do you get what I'm saying?
I totally get it.
If an industry wants me to just sell an eye drop, then again, that's very short-sighted. An eye drop that they produce, yes, it fits your agenda, but my agenda is not.
It's bigger than that.
To sell an eye drop, my agenda is to get people to know about the eye drop, and if they decide to buy it, great. But I need them to know how dry eye, the mechanism of a dry eye, and for them to understand that, keeping lid hygiene and doing warm compresses and cleaning your mascara will help you. And then the drop could be supplemental. Do you get what I'm trying to say? So
yes,
I think that, again, public health is very broad, and public health is a huge umbrella that all health professions fit under. So if we do not recognize our role in public health and to tap into it and maximize it, then that's on us. It should not be different. It should be working in tandem with each other. Now, does that answer both questions? I feel
yes, it does.
Okay.
It does 100% answer both questions. Okay. You're insanely passionate, eh?
Yeah, I mean, I've thought about this for a long time. So
you are insanely passionate. It's scary how, like, you're insanely passionate. I think the industry that's going to be watching this, I think when I think about it this way, yes, the work you're doing is important. You're going to make a huge difference. But on a personal note, for me, is the amount of board of directorships that you're going to be sitting on. That's what I'm excited about.
Well, thank you. That's
what's going to happen very soon. You've got a gift, and you it's as if you called for this. and it's bigger. Like I'm a firm believer that you have to have a vision that is far bigger than your current capacity
Of course.
to be able to achieve it.
Yeah.
And the universe will conspire on your behalf in
Amen.
order to fast track all these processes. And I'm a man of faith, you know. So
Uh-huh.
personally, I pray and I speak things into being, and I
Right.
believe that God is going to do exceedingly abundantly above and beyond anything that you
Well,
could possibly
amen. Thank
is
you.
going to happen. I'm super excited. This should be like part one. I don't think we can cover everything all at one go.
Uh-huh.
What you're saying, you unlocking as you answer questions, you unlocking a different thought process
Mm-hmm.
pertaining to how we view things or how we've always been
You think.
perceiving things.
Yes.
And so that's what has been challenging me in this conversation.
Uh-huh.
It's just you taking me into a different dimension of thinking,
Right.
and that is what I've loved the most in this conversation.
Great.
And what people that have been watching this or that are going to be watching this, what's your take home message for them?
So, like, for clinicians?
anyone, you, however you want to answer that question, what's your take home message for people that are watching this who have heard you talk about public health in the manner in which you have been speaking it about?
Right.
We could have covered so many other topics,
Right.
but I don't want us to be speaking for 2 hours because I feel like you have set the foundation.
Uh-huh.
So at the level at which we are right now, what do you want people to take from this conversation?
Well, I will start from being a student, right? Every school has a little bit of public health integrated into their courses. I think it's usually not robust. And I would just encourage students to attribute some importance to that class because there's a reason why that class is being offered. And,
Yes.
you are going to get out to take care of patients. And again, those patients are individuals. And if you take care of your individual well, you take care of every individual well, you are taking care of the public. Wow. Once again, with the so many examples that I gave with diabetes, our role as primary care doctors does not end with take your metformin on time, go exercise, go eat healthy. We can do more than that, okay? Yeah. Because you telling me African person go eat healthy versus telling an European person to go eat healthy, they are very two different things, okay? So kind of like going, giving them a list of recommended foods that they should eat. That interpersonal relationship, again, when you diagnose somebody as a physician, you have in your head what a priority is, but that priority may not be the priority of the patient. And maybe they have something more pressing. Again, if they can't put food on their table, they can't be eating healthy. So sometimes you should work with the patient to figure out how you are both going to tackle that healthcare issue. And so let's say that they have a housing problem. You telling them to go eat healthy and buy food, no, that's not going to happen. They need a place to stay. So sometimes you have to work with the patient and have that doctor-patient interaction and communication and helping them ask the questions that need to be asked, help allowing them to contribute to that decision making, because again, when they feel like they're involved, that would help very much with compliance. Okay, I can quickly think of glaucoma. If people don't understand why they are using the drops, if people don't know the magnitude of the condition that they are being faced with, they are not going to use the drops, knowing that they have to use the drops for the rest of their life and knowing that the drops are expensive. So taking the time and educating the patients, finding out what their concerns are, you also bringing your concerns, clinical concerns, and coming to a happy medium in between would be great for patient care. Now to the public, please don't take your eyes for granted. Again, you are going about your daily activities because you have a pair of eyes. And there are still people who go about their daily activities without a pair of eyes. If you want to be that way, I will not argue with that, but I would hope that you preserve your vision, and preserving your vision includes taking care of your eyes. The same blood that goes through the toes are the same blood that goes to your eyes, because sometimes people treat the eyes as an appendage, like God finished you and added the eye to it. But I'm like, if you keep yourself healthy, you eat healthy, again, when that blood is healthy, your eyes will be equally nourished. So put some value to your eyes, go get your eyes checked once a year, follow your eye doctor's instructions. Your eye doctors, outside of being a clinician, are individuals just like you. They have worries, they have concerns, they have problems just like you. So don't be scared of them. Just lay all the cards down and they will help you, because the goal of this is to be, a lot of us enter the profession to help people, and that's what we are there to do. So help us help you, kind of thing. You kind of meet us halfway. So that's my that's my advice out there.
Yeah. Dr. Otoo, thank you so much.
Of course.
Wow, you're so inspirational, and you are about to go on to this amazing journey where on a global scale, you're going to make a massive impact. We're here to support, we're here to hold hands and fight this battle of making a difference in eye care as much as we possibly can. And I can't wait to see you in person, because you are truly an incredible human being. Thank you very much for joining us on the Masterclass series. I'm super excited to share this episode with the global eye care community and patients all over the world, because it's such a powerful topic that you have just been talking about. So thank you very much.
Sure. Thank you for the opportunity to be on here.
It's only a pleasure. Everyone, make sure to subscribe to the Vision Straight platforms across social media. Connect with us on YouTube, LinkedIn, and so forth. But most importantly, connect and follow Dr. Araba Otoo, because she is one person you definitely need to have in your network. Until the next episode, stay tuned, stay connected, and keep making a difference in your community, guys.